Hello, everyone. Good afternoon. Thank you very much, JC, for the invitation. It's a pleasure to be among friends. So I got the task to break the ice and provide you with the framework regarding the impact on the global terrorism that COVID-19 has had. So I thought that it would be really good to be focused and provide you with some key words that represent the whole response that global terrorism has had to COVID-19. And first of all, we have uncertainty created by the spread of the virus. Then we've had fear. Of course, fear is the worst, actually. Daesh has mentioned several times that even more dangerous than COVID-19 is actually the fear coming from COVID-19. These two represented the perfect opportunity for terrorist groups to reinforce their strategy, to reinforce their speech, their rhetorics, and call for action. Then we have isolation that has several consequences at psychological, social, economic, political, and so on levels, and can eventually lead to chaos, to lack of trust. And all these are easily manipulated by the terrorist groups on social media. So let me begin by providing you with the main common traits that we have witnessed in terrorist response to COVID-19. First of all, we have the reinforcing hate speech. And that's a trait that we have witnessed among all the wide spectrum of ideologies. They have used the virus as an element to reinforce their ideology, their perspectives, and to validate them. They've done it in several ways. For example, Daesh sold the virus as a crusader, a soldier of Allah, who came as a punishment for the crusaders. So each group has used it in order to legitimize their own ideologies. Secondly, we have disinformation and extremist propaganda. We've witnessed a lot after the appearance of COVID-19 in the form of misguiding information, intentionally and unintentionally, fake news, conspiracy theories, especially in right wing, and hate speech that is directed to several target communities, such as the Asian community because of the origin of the virus, or the Jewish communities, just because it was a target before it as well. And then we have what I would call the most important, and those are the calls for action. The calls for action in order to conduct attacks, to seize the opportunity, to use the momentum, and attack the designated enemy, different from, that it's different from one group to another. Attack it now when it is most vulnerable. So we have those three main traits that actually are pretty much similar, and in terms of rhetoric, strategy, and means, those groups are pretty much the same. But when it comes to the responses, there are particular traces that we can witness in terms of their capacities and local circumstances. In terms of particular traits, we'll have a look at three main groups. We have Salafi Jihadi, right wing, and left wing. So Salafi Jihadi, I was telling you about the religious rhetoric, about the example with the soldier of Allah. The pandemic came up as a punishment. We have to use it against, the crusaders. We have to use it to reinforce our rhetorics. They've been using religious texts a lot, not just by, in order to make the propaganda of the virus, but at the same time to inform their members and their sympathizers regarding, the health part of it, as in the way they can protect themselves. They've used hadith from the time of the Prophet. They've been using information even from the international organizations such as WHO, but at the same time they've been also using information that was not real, in order to propagate fear. We also have calls for action when it comes to Salafi Jihadis, and if we take the example of Daesh, you would witness first calls to conduct attacks now when their enemies are at the most vulnerable moment. And secondly, and maybe most important, They are calling their members to free the militants or their families that are now in prisons and camps in Iraq and Syria. And that's a very hard card that they're playing, because right now, the international community, and it's not just something that appeared after COVID-19, but it happened before that. We don't manage the situation in Syria and Iraq, the situation in those camps and prisons correctly. Then we have politicizing the virus. You'd see groups like Hayat Tahrir al-Sham in Syria or the Taliban who are politicizing, using the virus in order to take control and show that they have control over the population. Now, when it comes to right-wing groups, you would see extremist groups, you would see a lot of conspiracy theories that are reinforced by the virus. You would see a lot of hate speech, especially towards certain communities. I was mentioning the Asian and the Jews. You would see a lot of anti-foreigner and anti-immigration rhetoric. You would see them blaming the failure of the neoliberal system just because of the spread of the virus. And when it comes to call for action, I would say that those are the most worrying propaganda that we can witness, because they call for mass infection of the enemies. They call for transforming the virus into a weapon, a very cheap one actually, either by weaponizing our own illness, or going and spreading the virus if we've got it, or spraying it in a bottle of fluids that contain it. So this is actually one of the most worrying call for action that we can witness. The left wing has also blamed the destructive nature of capitalism. They have blamed the measures that have been taken by the governments in order to contain the virus, saying that they are taking away our liberties and impose authoritarian rule. They called for action of creating chaos, plundering, destroying the businesses in order to accelerate capitalism's downfall. So because of the very short time that we've got, I want you to take three main takeaways from this presentation that begins the webinar. First of all, you have to understand that all those groups, although they seem to be strategical enemies, they're actually pretty much rhetorical allies. And this is witnessed in terms of the way they use COVID-19 as an opportunity to validate their rhetorics and to make a call for action in order to attack and spread violence and fear. Then you have to pay attention to the way disinformation plays a huge role in polarization and fostering emotional insecurity that is actually manipulated by those groups in order to recruit more people. We have also witnessing new targets, because the whole political scene has changed. All public spaces that have been used are not an option anymore. So the new easy targets that we witness are hospitals and care houses. And we also see the virus, or the call for action, in terms of using the virus as a weapon. The last takeaway that we have to understand and we have to pay attention to is the fact that with the COVID-19, the problems that we had in our societies has not disappeared. They actually got more intense, and they have been empowered by the spread of the virus. So the COVID-19 pandemic has the potential to now weaken domestic security efforts and international counterterrorism cooperation, providing a window for those groups to better prepare attacks, to hit us when we are most vulnerable, and to escalate campaigns of insurgent warfare on battlefields worldwide. So the last thing that I would like to mention are four main recommendations that I could make based on the research that I've taken so far. First, and this is not just on the current situation, but in general, we have to ensure an equal treatment of those groups. This regards the ideological spectrum. They are all dangerous. They are all equally dangerous. We have to ensure a better data collection when it comes to COVID-19 during the pandemic and afterwards. We have to provide a strategy for better data collection on domestic terrorism and hate crimes. We need to monitor terrorist footprints, which actually are spreading, and they're mutating like the virus, adapting to the new context. Then we have to develop strategies to identify, monitor, and of course, remove those disinformation, misguiding information that extremist propaganda has been spreading. And we also have to focus, because we've been pretty good at this, but we have to focus more on the gray area material, the one that is not immediately automatically removed. And last but not least, and this is not just for CT, but in general when it comes to the COVID-19 crisis, now more than ever before, it is the moment to develop a multidisciplinary understanding and a strategy, a multidisciplinary strategy that encompasses perspectives from all spheres of our lives that have been kind of affected by this crisis: psychological, social, economic, political, educational, medical, anthropological, cultural, administrative. This is the moment when we need it the most, and that means, you know, people from several disciplines working together to provide recommendations for what is needed to be done next. Thank you very much for your patience, and I'll pass the floor